So this new part now is involved now with the follow-up of a patient with stroke. So how do you follow up a patient that has stroke? Is it clear? So when you want to follow up a patient that has stroke, you need to know that what there is a goal of follow-up that is still going to based on the SHRBB algorithm. You start with the follow-up of the disease, you follow up the cause, you follow up the complication, you follow up the background, and you follow up also the prognosis. Is it clear? You ask for the prognosis and visualize. Now, the first thing is, how do you follow up the disease? To follow up each of them, you are going to use now the means of follow-up. And the means of follow-up is going to be divided into two. You have clinical means of follow-up and you have paraclinical means of follow-up. Is it clear? So those are the two main things that you have to know. You really need to know that you have both clinical and paraclinical means of follow-up. Now, for clinical means of follow-up, what are the different elements? So to clinical and paraclinical, when you want to follow the disease here is stroke. Is it clear? How do you follow up stroke? You can follow up it clinically and you can follow up it paraclinically. Is it clear? Clinically, you can follow up stroke by finding for muscle power daily. Is it clear? You can use so you can assess the MRC muscle power daily and other deficit daily. Is it clear? While paraclinically, you can ask for a CT scan in order to visualize for the progression of the stroke. Is it clear? You ask for the CT scan. Now, the next thing after the diagnosis, the second thing is that you can follow up the cause. Is it clear? If the cause was atherosclerosis, you can follow up that cause with the carotid bridge clinically. Is it clear? You can hear for carotid bridge clinically. Is it clear? And paraclinically, you can follow up if there is any change in the Doppler ultrasound on the level, on the dimension of the plaque. Is it clear? Paraclinically. Is it clear? You can also follow up for the other one, which is for the cardiovascular disease. If there is any cardiovascular disorder and other, you can follow up it. Is it clear? The third element, you can also follow up on other different causes. You have now to follow up the complication. To follow up the complication, it can be clinical, particularly the decubitus complication. You have to ask for the deep venous thrombosis signs. You have to verify for deep venous thrombosis signs like calf tenderness and all that. Is it clear? The Horman sign. And then you also need to evaluate now for what the lungs. You need to evaluate the lungs in order to find if there is tachycardia. So now you need to monitor the vital signs of the patient. Is it clear? To find for tachycardia, saturation depressed, or any disorder with the vital signs. Is it clear? Like or agitation of the patient that can tell you that there is a pulmonary embolism, which can be a complication. You can also evaluate clinically for constipation, for fecaloma. You can evaluate for bed sores at the level of the pressure areas. So all those complications can evaluate for them. And then the fourth element, you need to evaluate for the prognosis. Is it clear? So how do you evaluate for the prognosis on the follow-up? Generally, to evaluate the prognosis, you use in stroke, you use the National Institute of Health Stroke Score. Is it clear? The National Institute of Health Stroke Score. Is it clear? The National Institute of Health Stroke Score is going to be helping you in order to know, it's the prognosis of stroke. Is it clear? It's made up of 42 points. Is it clear? And those 42 points can be divided in order to divide the stroke into mild, moderate, and severe stroke. And that mild stroke, moderate, and severe stroke has a particular mortality in it. Is it clear? Mild is related with certain level of mortality, moderate certain level of mortality and irreversibility, and severe certain level of mortality and irreversibility. Is it clear? So those are the different elements that you have to know when you have a patient with stroke. Is it clear? And then when you have those different elements, now it can help you to know a clinical progression. So this is a tutorial that was done according to SHRBB, and I hope you like and subscribe for the videos. Thank you.